All right. Hello, everyone. Welcome to today's event, the State of Healthcare in 2025. My name is Jalen Vasquez. I'm the Director of Freelancers Hub. Thank you all for tuning in on YouTube. This is our first of many virtual town halls that we plan to have in the future. You will hear from myself and from our Executive Director, Rafael Espinal, pretty much on all updates that we're working on here at the Union and just other upcoming events that we have for just all of our members nationwide. And this is pretty much the opportunity for you to also speak with us, because we also want to hear what you have to say, things that you think we should be focusing on. If you have any questions or concerns that you think we should look into, definitely email us. I mean, use the chat right now, comments below, whatever it may be, but you can also email us at advocacy@freelancersunion.org. Our team will respond to you as quick as we can. We do get a lot of emails daily, but hey, we're here to help, and that's all we want to do. So some months we'll have different focus topics. Some months we'll have the opportunities for members around the nation to just virtually network and pretty much just connect. We know as freelancers can be really difficult to find that community, and that's the gap we want to try to fill. So be sure to subscribe to our newsletter and stay updated on all of our future events. Subscribe to our YouTube page, comment below, like this video. Anything you do, stay in touch with us. But now a little bit about today's event. We have a great discussion for you today with some great speakers from some of our insurance partners. We're going to be talking about what healthcare could look like with this next administration coming up. We know it's Inauguration Day next Monday, but yeah, people don't know what's going to happen, but hopefully we can figure things out and try to just help you as much as we can. But before we do bring on our panelists, I would like to introduce our Executive Director, Rafael Espinal, and Jonathan Gray, our Director of Insurance and Benefits, to talk a little bit more of just how things currently are and what steps you as a freelancer could take. So give me 1 second. Let's see. Hey, Rafael, and hey, Jonathan. How are you? You hold up. There we go. You muted yourself, Raf.
Sorry about that. Well, thanks, Jalen. Thanks for having us and leading this discussion. As you mentioned, this is one of many conversations we hope to have over the year. And for those of you who don't know, the Freelancers Hub is a free co-working space and our headquarters in Brooklyn, where you as an independent worker, if you happen to be in the 5 boroughs of New York City, can have access to a free co-working desk while also having access to our programming, which we try to host at least once or twice a week. But just to start off this discussion, I'm Rafael Espinal, I'm the Executive Director of Freelancers Union. And I'm really thrilled to welcome you to this conversation about the future of healthcare in America and what we as an organization are doing to provide you with access, working with some of the best partners, providing some of the best options out there. And I think we can all agree that healthcare is an issue that touches all of us, but it remains a particularly challenging space for independent workers who often find themselves navigating a system that doesn't account for the unique needs. And I think I can argue that that is the case for all issues affecting freelancers in our country. It's also important to acknowledge that we are entering a time where we can expect a shift in our federal policies, as Jalen mentioned earlier. And I know there are a lot of questions and concerns about what that means for healthcare and the Affordable Care Act, whether it will stand, how it might evolve, and what if a repeal happened, knock on wood, what could it mean for millions of Americans? And that's why we're here, to help unpack challenges and explore opportunities to build a system that works for everyone while learning what our current options are. And to help begin answering some of those questions we already received, I'll get into some of the points. First, in terms of the Affordable Care Act, repealing it is not a simple task. It's a process that requires the majorities in both the House and the Senate, along with the president's signature. And while the current political dynamics can create an environment where repeal can succeed, there are structural barriers like the Senate filibuster and overall public opinion in congressional members' districts that will make it a challenging road ahead. And second, the Supreme Court continues to be a key player in determining the ACA's future. I know there are some questions about how much can the Supreme Court actually intervene. And while, in the past, the court has upheld the laws in previous challenges, its current composition, as we all know, is now dominated by more conservative justices, and it could lead to significant challenges and changes if new challenges arise. So while the Supreme Court cannot repeal the ACA in its entirety on its own, the court can have decisions on specific provisions brought before it in legal challenges. For instance, It could rule in the constitutionality of certain aspects of the law, such as Medicaid expansion or protections for pre-existing conditions. And if key provisions are struck down, it could create significant disruption in the healthcare system as we know it, leaving millions of Americans vulnerable, unfortunately. And that's why this moment demands careful attention to both the legal and political landscapes shaping healthcare policy. Now, we also received a question about the political motivations behind efforts to repeal the SCA. And for some, it is about reducing federal involvement in healthcare. And for others, it's tied to cost concerns. However, what we've seen over the years, and the good news is that public opinion has shifted significantly. The ACA's provisions like expanded coverage on protections for pre-existing conditions are now widely supported. Lawmakers are increasingly aware that dismantling these protections without a viable alternative could lead to serious political consequences in their home districts. And this is all to say that, we at Freelancers Union are committed to following the conversation closely and ensuring that your voices are included in every step of the way. And any legislative or regulatory changes that would directly impact our community, we'll make sure to keep you informed of any updates or shifts. And there are, there will always be moments. There are going to be moments where, there are moments where we do rely on you and our community, and this is going to be one of those times. So we will need to speak up and get involved to ensure when those times comes that we are doing everything we can together to ensure your needs are met. So with that said, I would like to move forward with today's conversation. We're proud to partner with a group of partners. We have Catch, we have Solo Health, and we have Opolis that provide what we believe to be some of the best healthcare options for independent workers. Today we'll hear from them about what they're offering to serve your needs and how they're working to improve healthcare access for freelancers. And we also look forward to continuing collaborating with them, as the landscape changes and evolves in the future. So this is a moment for honest dialogue, and I encourage you all to share your thoughts in the chat box during the Q&A portion of today's event. And together we can work towards real solutions that prioritize the needs of the independent workforce. So before we introduce our panel, I'll hand it over to our Freelancers Benefits Director. He is Jonathan Gray. He oversees a lot of the tools and products we offer to ensure that you as a member have the social safety net you need to meet any of the challenges beyond healthcare. So Jonathan, thanks for joining us, and we'll give you the mic to talk about all the great offerings we have.
Thank you, Rafael. Good afternoon, everyone. As Rafael stated, my name is Jonathan Gray. I'm the Director of Member Benefits at Freelancers Union. Together, we worked hard to seek out and curate a range of affordable coverage options that are tailored specifically for the diverse need of our members. We know that one size does not fit all when it comes to insurance, and that's why we're proud to offer these choices to ensure you can find the right fit for you and your family. I'd also like to take a moment to highlight our Guardian Disability and Dental coverage, which has been particularly popular amongst our members. Our long-term disability plan is vital for our members. As self-employed individuals, you do not have the luxury of vacation days or employer-sponsored sick days to fall back on. So if you have an illness or injury that prevents you from working for an extended period of time, this coverage ensures you will still have income to cover your essential needs and expenses. Through our advocacy, we were able to offer a group rate, providing significant savings compared to purchasing it on your own, making it accessible and valuable for a safety net for our freelancers. Now, there's two common conditions that people may need to rely on long-term disability for, and these could be back issues or even mental health issues, such as severe anxiety or depression. Back issues include chronic pain or injuries that can severely limit your mobility, which can cause you to be unable to perform physical or even desk-based jobs. Long-term disability benefits can help cover your essential expenses while you undergo treatment or rehabilitation to give you time to recover without any financial stress. And we all know mental health conditions, can impact focus, productivity, and even your overall well-being. It can make it impossible to maintain your workload. So long-term disability can actually step in and provide you Financial stability allows you to focus on therapy and recovery without the added burden of any lost income. Now, this coverage is not just about financial support. It's about giving the self-employed individuals the peace of mind to focus on their health and well-being, knowing they're protected if life takes an unexpected turn. Our goal is to make sure you have the support and benefits you need. And I can kick it back over to Jalen.
Cool. Thank you, John. I mean, as John said, just keep in mind everything that we have. I mean, you can always look up all of our resources on our website at freelancersunion.org. Definitely take a look at our website. All the appropriate links as well that we are mentioning for this stream are in the description. So it's right there at your convenience. Just click that. It will redirect you to the correct page, especially of our partners that will be speaking today. Let's kind of move forward with this chat. We're going to bring on our panelists. So like Rafael mentioned, we do have our main partners that we've had this year for our insurance. We're joined by Catch HPG Solo and by Opolis. So you may have seen a lot of the events we've thrown with them the last month or so, but we're very happy to have all of them here. So first, I'd like to introduce Alexa Irish, the co-founder of Catch, and later she will be accompanied by Chloe Jackson during the Q&A. How's it going, Alexa?
Hi, everyone. Great to be here.
Just quickly, if you can you just talk about what Catch is, if anyone hasn't attended our previous events?
Yes. For anyone on this call who has ever touched healthcare.gov or any state exchange, we make that process easier for you. We are a free resource to get you signed up, enrolled, and most importantly, make sure you're taking advantage of all the tax credits available to you. So we just make that whole process easier, and we love partnering with Freelancers Union members to do it.
Cool. Thank you so much. Our next guest speaker is Tom Morrissey, the CEO of HPG Solo, and later he will be accompanied by Jason Hansen, the COO of HPG Solo. How are you, Tom?
Good afternoon, everyone, and thanks, Jalen.
No problem. Can you tell us a little bit about HPG Solo, please?
Sure. Well, first, I'd like to thank Rafael, Jonathan, and you, Jalen, for choosing Solo Health Collective for the offering for January 1. We are a relatively new health plan. We are designed to be for solo business owners, solopreneurs, certainly freelancers fit that bill. What's unique about our health plan is that it's a business plan where your business joins our captive through our partners named Vault Insurance. They've got a couple thousand businesses on the plan now. We did quite well at open enrollment with Freelancers Union. About a third of what we wrote as a business came through the Freelancers Union. So we had a great run with you folks, and we do appreciate that. Another unique part of what Solo is all about, and one thing I'll say before this is that what's great about what Freelancers Union offers for health plans from where I sit is with Catch.co, you've got a great opportunity for simplicity, as Alexa said, on ACA plans. So everyone should be checking out everything that's available to them. So check out Catch.co, check out Opolis. Where we fit in, it's kind of a niche, if you will, or a niche. It's we go through health underwriting questions, and those that can get through the health underwriting questions and have an EIN or want to obtain an EIN, they can join our collective at very competitive rates.
Cool, very cool. And last but not least, we have John Pollard, the founder and steward of Opolis, and later he'll be accompanied by Micah Baylor. How are you, John?
Good. How are you?
Pretty good. Thank you for joining. And can you talk a little bit about Opolis and what Opolis does for our members?
Sure. So Opolis is a group health insurance plan that sits inside of what we call a solo EOR service. So essentially, we have an employment cooperative that becomes your employer of record by technical designation. And then as being a member owner of the collective, so our structure is actually set up as a cooperative. You get access then to various benefits, which also includes our national coverage group healthcare plan, which is top drawer and equivalent, you could say, to like a Fortune 100 group healthcare plan.
Very cool. Very cool. A lot of different things, a lot of different offerings, which is good. And that's what we always like to do. And that's what John, our insurance director, would likes to find is we like to give people different options that fit the best for them. We don't want to force people for any specific product. We like people to be knowledgeable and have most information they can to make the best decision for them. So let's get on to the couple of questions. We did source some questions, and just to kind of figure out where all of our members were at, just kind of seeing what people wanted to know. A lot of questions, just a lot of the uncertainty of how things are going. So my question for all of you, if anyone would like to answer, feel free. My first question for you is, how would the removal of the ACA impact the current healthcare system and your representative companies? And what do you foresee happening to folks with either pre-existing conditions or needs of subsidies? Whoever would like to tackle it first, feel free.
Yeah, I'll
Sure,
take
go
it
ahead.
if I may. First of all, from my perspective, just a little background. I've been in the business of the benefits world for 35 years. Spent 25 years, and please don't hold it against me, with one of the large carriers. But we started Healthy Business Group 14 years ago and really just created HBG Solo with a soft launch for January 1st, 24, and our major launch after building the plan throughout 24 for January 1, 25. That being said, as you posed the question, Jalen, from my perspective, I think it's highly unlikely that we will say goodbye to the ACA. If that does happen, and again, I don't think it will, but if that were to happen, I think it would be utter chaos. A lot of people are being helped out by the exchanges. So if you look at, I think one of the greatest resources available to the public, and all the folks that are on the phone right now can go to the Kaiser Family Foundation to look, and they really do a great job about what could possibly happen with this new administration and the changes that are, there's going to be changes made, but how drastic will they be? God knows. But again, I highly doubt they will repeal completely the ACA. And Rafael talked a little bit about that at the beginning. But just so you know, and I'd like to kind of get everybody on the same page, there has been tremendous growth in the ACA. The ACA has doubled in size since for lower paid people that are heavily subsidized and getting significant subsidies on the exchange. The population has doubled since 2020. You're looking at 19.7 million people receiving subsidies from the ACA. Very important. There's only 1.7 million people on the ACA that do not receive subsidies. So as I look at things, it's pretty clear that something will happen with subsidies. There is more than likely going to be challenges to changing the game with subsidies. It's certainly our hope that the people that need it, and again, I think this is the people that have been helped so far, that are getting, where the growth is. There's the double in size. The people that are at 350% or below the poverty line, that are getting, as much as a $700. I guess the average annual savings on the exchanges in the last year have been $705 per enrollment. That obviously is averaged out for family and individual coverage, but it's a significant savings, and that's why people have joined. And if you take away those subsidies, if you take them away completely for the lower income folks, that would be a horrible thing. I think that hopefully we can all rally and get behind subsidies staying in place for those that need it the most. Now, what I'd add to that, though, is I compete every day. We compete with other health plans around the country, and we're not an ACA plan, so there's no subsidies. I do hope that there'll be consideration taken to change the game with the Inflation Reduction Act, which extended the subsidies, but it extended the subsidies to people that are even above 400% of the poverty line, where no one it has to pay any more than 8.5% of the cost of the second least expensive silver plan on the ACA. That, I think, some of that's got to change. There's some people out there, we looked at people maybe living in New York City that make a couple $100,000 a year as a small family, and they're getting significant subsidies to jump on the ACA. That's costing taxpayers a great deal of money. So, long story short, we'd like to see as a business, we'd like to see the ACA stay in place. We'd like to see the subsidies stay in place for the people who need it most, but where you could strip away some of the subsidies is on the higher paid people that I don't think need it as much.
Got it. Cool. I mean, that's definitely a lot to think about, a lot to take in. I know that's the biggest thing we always see is just the increasing prices, just everything, whether it's healthcare, just groceries, everything, the cost of living just going up completely. So we do see a lot of members that it's difficult. So finding affordable plans is always key for us, and especially ones that give a lot back to the plan, where past plans we've seen or heard stories where members will pay prices that like either deductibles, it's just, they don't get much for it. But John or Alexa, do you have any thoughts for
John, you're
that?
welcome to go first if you're teed up. But
Well, I have a sort of, I don't even know if I'd call it a love-hate relationship with the ACA, but it's, anything but affordable, and the care is questionable. So the challenge is, the way that it was architected, the minute that the individual mandate was removed, it's no longer a sustainable game design, in my opinion. The subsidies were supposed to come from not just taxation, but come from those that are under the healthy population who are paying premiums into the system. And those guys aren't doing it now. So there's a pretty large population of folks that are, even with COVID, is sort of a lingering thing, that still just don't either have insurance, or they choose to stick with catastrophic coverage or something like that. So if the ACA went away entirely, which I agree with the sentiment that I don't think that it's going to go away entirely. In fact, I think it would be not just politically, but functionally completely foolish for anybody to say, well, let's just get rid of the ACA without actually coming up with something to replace it. I personally, I've been in payroll, employment, and insurance for 25 years. And I would say, having seen this from multiple angles, that underwriting populations is very hard, it's very expensive, and it's almost impossible to predict. Managing prices is difficult for various reasons, some of which that the industry has no control over. And the overhaul that needs to happen to how the healthcare system, and notice I didn't say the health insurance system, the healthcare system is a predicate to fixing the health insurance system. So how does that happen? It's a giant layer cake. I don't know that we're never gonna solve that issue on this particular call. But what I would say is, Opolis, for example, was founded to give a choice to an alternative, and we're a one-stop shop that integrates a lot of the various services that you might need as an independent worker in order to function your business. And we try to essentially replicate the experience of employment without actually subjugating yourself to another company. So you get the benefit of group healthcare, you get your tax compliance withholdings, you get a W-2 for proof of income, you get all of those various benefits. So you can kind of like have that, safety and security nest that you might normally feel working for somebody, but you're not just subjugated or just relegated to having to look at the state exchanges for super high deductibles and limited doctor networks and all of that stuff. I mean, our plans are all national, the premium doctor networks, like all the things. And then we also have some more, affordable, affordable plans that are like high deductible plans. I'm actually on the high deductible plan myself because I prefer the health savings account. I like the HSA, and I don't go to the doctor much. My kids are pretty healthy. So we give a lot of variety of options. Our main competitor, actually, I would say, is probably the ACA. So when people are independently shopping for insurance, that's where they go, is the state exchanges. And then we're able to offer better pricing, usually, depending on the state, and definitely better care coverage. So do I think it would be impactful? I think it would be a mess if we just got rid of the ACA. As previously mentioned, the lives under management on the ACA are now really, really big. I mean, they were big before, but they've gotten even bigger. I think COVID spurred a lot of people who were on the sidelines to kind of, well, maybe I need to get health insurance now. So we've, as double, I think, is correct. And yeah, it would be a very bad idea for anybody to cavalierly come in and just, try to chop the knees off. I don't think that's going to happen. I think, one, the lobbies are too powerful. And I think, two, there's a systemic overhaul that needs to happen, that it's not just going to get solved by getting rid of it. And in fact, it's trading one set of pretty bad problems for probably a lot worse.
And I'll just chime in from Catch. Sorry, Jalen.
Go ahead.
I was just going to say,
go ahead. All you.
We're partnered directly with healthcare.gov. We work with them all day, every day. And same for the state exchanges. Over 24 million people enrolled on those plans this year. And that's a record-breaking number, like we've all talked about. I would say the thing we're paying a lot of attention to, which Tom, you mentioned, is the American Rescue Plan and what happens with all those extra savings. So over 90% of people who enroll on the exchanges right now get discounts, and 8 in 10 of those people are getting plans for $10 or less per month. So that's a huge, huge number of people. The kind of extra savings are protected through the end of this year. And we're just paying a lot of attention to what happens in 2026 and beyond, and working really closely with the team of folks on this call to make sure that we're all aware and abreast. But what I would say is 24 million in force is huge, and those numbers grow every year. So the more we're engaging with the platform, the more we're showing that it's valuable, and it's hard to rip away benefits from that large of a group of folks.
It's good to know. Cool. So my next question, some of you touched a little bit on it. Do you think, like, either on a federal level or a local level, that the government should play a role in ensuring healthcare across, whether ACA is repealed or some other alternative?
I think it depends on what you mean by have a role. If you want to talk about,
they already do.
They have a role, yeah. But if you want to talk about going to like a single payer, government run healthcare system, I say, no, I don't think that's a good idea. And I also don't think it's good to go back to the Wild West of where, carriers get to do whatever they want, whenever they want. Our philosophy is, taking a step back from the existing system and looking at the game design incentives and how providers are incentivized and how consumers are incentivized, how governments are incentivized, whether it's the government or big corporations running all of this stuff, the incentives are pretty bad. And there's not, really great outcomes, or, just talking about, forget insurance again, but just health. We don't have a good systemic incentive around health in our communities. We just don't. We're treating illness. We're not actually incentivizing health. And so our philosophy is, wouldn't it be interesting if you put a bunch of people into a community-owned insurance effort and we redesign the incentives, right? So we can still be for profit, but the profits go to the members, right? So we contribute, but then we don't have incentives to be overly exploitive or extractive, right? Because if you're owned by your members, you're not going to go predatory on that. You're not going to just try to rip all the money out of there. You want to build something of value that can be sustainable. Secondly, when you talk about care and what people want, you can now design things that fit various lifestyle needs. Jonathan said early on, it's not a one size fits all thing. And that's very, very true. Everybody's got a different need. I've got a high tolerance for deductibles in my family because we don't go to the doctor much, but other people have ongoing, things, conditions of health that are just different. So we've got to be able to provide variety and sustain value. And then risk management's really tough, though. This is the one where if I were to say the government should have a role, I would say, when we talk about pre-existing conditions that are systemically like really expensive, and, we've seen in our plans medications that cost $15,000 a month. And we, this past year we were self-insured. So we're paying these out of our, member premiums. And it's like 15 grand a month. Like, what are you doing? And there's like a few people on that particular plan that had similar issues going on. So, we're talking, mean, an incredible amount of consumption versus what they're paying into it. So that's a real threat. That's a real risk to sustainability. So if I think that there's one place the government should play a role, it's in helping subsidize high consumers of expensive services. Now, there's a whole other issue around why things cost so much, and around the healthcare providers and the drugs and all that stuff. But I think if there's one thing that they could, the government should help with, it's de-risking and incentivizing community pools like ours and others to take on as many people as possible, because these kinds of things, the insurance industry will call it lasering, where somebody will be a high consumer and then they'll start targeting our plans. They'll start making it difficult for us to do business. So the government could really help out with that, I think. But then I think that begs another question of how you actually mitigate those costs and risks, even from the government perspective.
Got it. I mean, yeah, I mean, it's definitely a lot thing, especially like you said, with medicine and prescriptions. Like I know people, I even remember with everything with insulin, like insulin prices were so high for folks with diabetes. Like I think
it's insane.
It's insane. Like $1,000 like per. It was insane. It's just like
it's total insanity.
How do you expect anyone to pay this?
Well, and so Tom's talking about his health, and I see all the comments over here about health screening. It's like, I empathize with Tom in the health questionnaire, because it's like, as a service provider, we have a responsibility fiduciarily, and even as a community-owned entity, to preserve the value and benefit for everyone else, right? So why would I give that up for one guy who I know is going to be a $3 million drag onto the plan? We just can't do it. And it's like, and yes, again, the providers, the drug companies, all of these people are guilty of contributing to this problem, which again, is all of that needs to get solved. We need to look at the incentives and take a step back from all of it. But like, it's a really tough predicament that we get put in. Sure. And it's something that we, as a member-owned community, we try to say no as little as possible, because we want to bring as many people as possible to the Opolis community, because the bigger the better. But that's not always so true if everybody with, not anymore with insulin, being capped, but like, there are other things that come along that you see like, wow, it really costs that much to do that every month. Like that's bananas. And I mean, you're talking about more than what people make in salaries just for a medication. It's absolutely wild, the things that we've seen. And so, we're constantly thinking about like, I mean, our we're not just trying to provide a service and build a community of people in a kind of an analog way. We're looking at new game designs, tokenization. How do you create new value centers and new incentive structures to actually get people to, one, be healthy, and two, participate in a community organization that can actually solve the healthcare, let's call it a crisis, because it kind of is. Consumers are put in a really wildly difficult predicament. If it weren't for organizations like ours, between Solo and Catch and Opolis and a few others, independent workers wouldn't have a choice, and then, having advisors that can help you navigate all that nonsense too is really difficult. So, there's a whole bunch of things here that I could like opine on for hours and hours and hours, but I will not do that. And I will let the other panelists have their time.
Yeah. If I may, I just want to share one thought that I have regarding, the playing field in the underwriting process that we go through to enable a business owner that is healthier than average get on a plan that is more like what they're paying for is more like what their actual cost is. I have a real hard time with, and you got to kind of put subsidies aside for a moment. But if there were no subsidies and the ACA was made up of, 25 million people like it is today, the adage is about 20% of all claims are driven. 20% of the population drives about 80% of the claims. So to me, 80% of the population subsidizing the population of 20% in the ACA that are less healthy. I think that especially for freelancers and solo business owners, that is patently unfair. where you got to give them an opportunity to buy something that is more like what their actual cost is. So what do you do with the higher cost claimants? That's what I think could be a major switch, where the federal government comes in and funds the high risk pools, but not on the back of the individual business or the individual freelancer that is 27 years old and paying $800 for a silver plan in New York, when their actual spend is going to be more like $250.
Right.
Just wrong. So
yeah,
I see.
Where do you think that happens, Tom? Does that happen in Medicaid?
It happens on the ACA for sure.
Or just, yeah, okay.
New York is a unique market because they're community rated, but they're doing so from a mission perspective, right? Like they want everyone to have access to coverage, which is why they're making an active choice to even out those plans. So I think there's an argument for it. Yes, if you're young and healthy, you might carry that cost, but if you're on the other end of the spectrum, you also get it evened out for you. So we're big believers in equality across the board. Every state handles it a little bit differently, and the healthcare.gov folks handle it in one way across their 30 plus states. But I think there's an argument for it on both sides.
Well, what I'm opposed to is if you look at what employers do, employers are working very hard day in and day out to improve the culture of their organizations and the overall health of their organizations. And, a lot of them are having people pay more if they're smokers, having people pay more if they're not doing their preventive screenings. There's nothing really like that going on in the ACA, that's working anyway.
Certainly opportunity for it, yeah.
Again, there's tremendous opportunity to reward better health, have the government pick up the higher risk pool to take care of the financing side of that. And then, we know this new administration is made up of conservatives that want less government, right? So there's a lot of talk about perhaps if the subsidies stay in place, they can be available to those that don't want an ACA plan, that want a private plan. So there'd be nothing wrong with somebody, a business like Solo or a business like Opolis, being rewarded with subsidies. The person joining Solo or Opolis in a high deductible health plan, the subsidy could come through a subsidy funding their HSA plan. And there is talk about that now. So I think it's going to get very interesting. I think it's going to get very creative. I think what we're likely to see is, more going towards the private sector, letting innovation happen, because that's the only way it'll happen. It's not going to happen in these plans. Now, just a final thought here. We talked about the repeal of the ACA, the possibility of that. Again, I think it's very remote. One of the reasons that I think employers would be against that is if the subsidies fall significantly, not a repeal, but if they get rid of the subsidies, you're going to have massive movement off the exchanges. People are going to go uninsured.
Yep.
Doctors are going to lose their patient panels. They're going to raise their costs everywhere else. So it's like squeezing a balloon, right? It's like John keeps pointing out, it's a major cluster bomb here, and it's true. It's just a disaster. But I do think relaxing the rules for private organizations to innovate is a solution long overdue.
Hear, hear.
That was actually going to lead into my next question of, are there any other alternatives that you think could possibly work to the current system that we have now?
Well,
we probably all think there's opportunity for that.
Yeah, I mean, my 2 cents opinion on that is like, I really actually kind of hate the way our system is designed, just generally. There is so much centralized power and, tomfoolery, if you will, that goes on in, pricing and plan design and actuarial stuff. And like, I mean, there's just, even reinsurance and,
right.
all this stuff is just gross. And it doesn't even really work that well. So do I think there's opportunity? Yeah, I think there's huge opportunity. Now, how do you effectuate that opportunity? Is it going to be legislative? Maybe, but I think that's more of a step change thing. I think where you're really going to see, I think to Tom's point, relaxing restrictions and incentivizing innovation and putting it to the private sector to essentially, kind of hack on it, when it comes to like spinning up new entities and trying new things and whatever, like, and actually creating incentives to do that instead of making it really hard to get in. Make it easy, make it easier to get in and be supported, give people, sandbox opportunities to like experiment with things. Who knows? I think that kind of environment would be the best to create a tectonic shift, because if somebody really caught traction and they had a whole new model to underwriting and paying and, all these things, doctor networks, and then it's like, well, how do you stop that? I mean, maybe the incumbents would want to stop it because it's bad for them. But if you've actually got, this is where the government needs to take a stand on, they're going to prioritize innovation over protecting incumbents. And right now, the government even protects itself. Like the ACA, they protect it, right? Because they don't want it to go away, because it's like bureaucrats are bureaucrating. But at the same time, it's like, I understand the value of that, especially I agree wholeheartedly with Tom around, them subsidizing the high risk pools, because it's impossible for anybody in our position to like take that on scale. Innovation needs to be prioritized over protecting incumbents. And not that incumbents can't play the game, let them innovate too, but they don't have incentive right now to innovate.
Yeah. Well,
they're protected. Yeah, go ahead.
So just, an example of what you're talking about, I think, is, look at the network. And this is, again, Kaiser Family Foundation has a lot of info on this. But, the carriers are winning big time. And when I say carriers, we call it the BUCA, the Blue Cross, the United Healthcare, Cigna, Aetna. They are winning big time, and so are the regional HMOs. The problem is the subsidies are so big that the carriers all want to play. But what the carriers have done is they're shrinking their HMO networks down to 60% of what they sell commercial business for. Private employer business, their networks are double the size. And it's because they're manipulating their networks to have the lowest paid doctors. Look, the fees paid for the fee schedules paid on the lowest doctors. They're thinning out these networks to save money. They're, lock-in HMOs for the most part. There's not a lot of PPOs on the exchanges. So they're running away and to open up and level the playing field, deregulate that, put more regulation into what they can do. To me, a carrier should have to sell their HMO on the same HMO network they sell on to commercial businesses on the exchanges. And that'll never happen.
They're never going to do it.
Right. They wouldn't do it, but I think there's reason to really poke at it, and maybe there could be some type of restrictions on that.
Yeah, and I think for us, just as an organization, like, we just kind of have to believe the system has to be equitable and accessible. I mean, it is hard. There's so many things that we are trying to do, like all four of us just trying to help more people. And it's just something that we kind of have to discuss, whether if it's with our community, with our partners like you guys, just to see the most we can do. But yeah, unfortunately nothing's perfect, but all we can do is just the best we can.
Well, we've got to do the best
but
that
I
we
do want to
can.
move on. Go ahead.
I was just going to say, we got to do the best that we can within the framework we're given. And right now, I think, and I think, like or hate the Trump administration, I think there's a lot more appetite for innovation coming in than going out. And, that's what I'm about. I'm about innovation. I'm about like big step changes, not, or big jump changes, not step changes. I like to see evolution, but revolution might be better in this case. And, you got to give people the opportunity to innovate. And if we don't have a landscape of innovation that we can really do this, it's never going to happen. And we're going to, the ACA was essentially, in my mind, rewinding the clock, having been in the industry this long. I'm that many days old to be able to say I watched the ACA get formed and implemented and all of that. I've seen it. The ACA was just the first brick in the wall to try to go to single payer. And there's almost like on purpose inefficiencies that get pointed to now and say, well, this is really inefficient. We got to get rid of this. And on the left, it's like, well, single payer is the only solution. And on the right, they're like, well, we got to get rid of that because it's like, it's not good. And it's like, it's a mess. So innovation. We've got to incentivize and empower businesses, innovators, entrepreneurs, and communities to come around this really complex issue and create solutions that might be able to scale. So right now we just need more latitude and we don't have it.
I don't know, Jalen, if you're on mute.
Yeah, Jalen, we can't hear you.
Yeah, we can't hear you, Jalen. You don't look like you're on mute. Somebody torpedoed his audio. Uh-oh. Now he's frozen. Are you back, Jalen?
All right, I'm here. Again,
Rafael.
so it's been a great discussion. Thank you all for chiming in, and definitely, I know it's not an easy conversation. I know for a lot of our members, it's probably not easy to hear how complicated things are, but I think we could all agree that it is complicated.
Mm-hmm.
In Freelancers Union, historically, and it's part of our mission to try to find novel, community-driven solutions for a workforce that historically has gone underrepresented, under-resourced, and it's 2025, and I think that now more than ever, I think it's time we start having this broader discussion how we finally include the independent workforce in the conversation about our economy as a whole. I don't have the questions Jalen's had prepared for us, but I think we can probably I think there was a point that was made up earlier about subsidies, right? And I think that might be that is going to be a huge pain point. It might be the easiest I guess low-hanging fruit for conservative lawmakers to go after, right?
Yep.
And what does that mean, right? I think currently there's subsidies for individuals with the incomes ranging below $60,000. Correct me if that number's.
Yeah, it varies basically geography to geography, but yeah.
Yeah, and that is definitely something we'll be keeping an eye on, right? Because that means that if you're making under that income threshold, you'll be thrown into the pool of paying the full amount and full price for health insurance coverage. So just want to reassure our community that we're going to be keeping our eye on that and relying on them to advocate to ensure we keep those subsidies. But aside from that, I think there were a lot of questions about our work as an organization and why we're working with some of you, but we work with everyone, right, to ensure that no matter where you fall in the income bracket, no matter where you fall, with your family size or whether you have pre-existing conditions, we've worked internally to create a comprehensive group of amazing partners, so that if you fall in any bracket, there is something that's going to be there that works for you at an affordable cost and an affordable rate. So we are very proud to work with Catch and Solo and Opolis to provide all of these options, and looking forward to the continued work ahead. And I guess
can you guys hear me now still or no?
Yes, we can hear you.
Yeah, we can hear you, but not see you.
I don't. Okay.
So you flipped it. It's okay though. It's probably better. No, you're fine. Just talk, man.
What's
You're good.
happening. But like Rafael said, I do want to thank everyone for taking part for this. I am looking just at the questions that were submitted. I know Rafael just addressed a few of them. Someone did ask if we have insurance in Ohio, and the good thing is all three of these companies are nationwide. So I know we have partnered with companies in the past before that are specific to states, but these three here are all nationwide, which is really good. I'm just searching if there's any other questions that have come up in the chat. A couple good comments that I think I saw one that came up that I thought was really good, but it was pretty much about lobbying and communicating. There we go. Here we go. This is a good comment. Part of the given framework we all have now is that the union, whatever group, lobbying, communicating, we can do to push these initiatives forward and would benefit us as a group. Rafa, do you want to talk a little bit about just like whether voting or just kind of doing your research of who's supporting what, especially on the local level?
Yeah, I mean, we're still doing that work, and I think this initial discussion to hear from you, the community, to kind of get a sense of what's important, what we should be keeping our eye on. But as things shift over the next few weeks and the next few months, it's going to be up to us to create a list of policies and a framework that we think will be best for independent workers. And when that time comes, we're going to be leaning on our federal legislators on both sides of the aisle to ensure that your voice is injected and included in the conversation.
Cool. I'm trying to just look if there's. Go ahead.
Just to cap that thought, keep opening our newsletters, and you'll likely see communications from us through our blog or through or direct emails on how you can get involved in helping us frame the discussion.
Cool. I'm going to actually bring on all the company's secondary speakers as well, just in case if they want to throw in any of their thoughts, just as a final wrap up. And I'll bring in John as well. No, now it kind of looks like the Brady Bunch, so that's all right.
I'm Marcia.
Hi, Chloe, Micah.
I just want to say for anyone who
Jason, Chloe, or Micah, feel free.
Yeah, anyone who's confused or just wondering or curious about what their options are, please feel free to reach out to us. We are definitely here to help. And, even if it ends up that we're not the solution for you, this is why we partner with freelancers unions and other organizations like this. We want to make sure that you find the right option for yourself. And we're happy to talk through that, whether it be subsidies you're eligible for, the different types of plans, what you have a tolerance for, and figure out what's best for you.
Yeah, I would echo that. I always just review everyone's options when they're coming into Opolis, because sometimes I tell people to go somewhere else because it's better for them. And we're community owned, and my job is to take care of the owner of the cooperative, and the owner is you. So if my plan's not the best thing for you, I just tell you that. I'll say that looking at the ACA and things that will probably change, I think it's going to give us a lot more options, but this will also create a lot of pitfalls, I believe, where people will find out that thing wasn't included in their plan. And it's going to come back to the reality, healthcare has always been a very human thing. It's always been like, how do you make this thing AI-ifiable so you don't have to talk to a human to get it done? But at the end of the day, like, healthcare is one of those super personal things where you feel a whole lot better if you speak with a human being. I would encourage you, whoever you choose on this page to come and speak to, just talk to a person who's empathetic and hears your problem before they say a whole bunch of stuff to you.
Mm-hmm.
That's very important. Definitely agree with that.
Yeah, and I
Jason,
guess
it sounds like all three organizations have one-on-one live support. So
that's what I was just about to add, Tom. I think everyone here has one-on-one support. So you can definitely call them, and they'll have a dedicated person there to answer your questions and concerns. And also, we're here as an organization. You can email advocacy@freelancersunion.org.
I love talking about health insurance. Come by and stay a while.
One plug from us, it is still open enrollment on the exchanges, most of them at least. So if you either haven't enrolled for 2025, you still can for February 1st in almost every single state. Most deadlines are tomorrow. If you're in California, New Jersey, a few other states, it's the 31st of this month. Also, if you want to switch plans and you are on an exchange plan, you still have the opportunity to do it. Or if you want to leave the exchange and go to any of these other folks, now is just the time to make those decisions and choices before you're locked in for the year. So take advantage of the 24 plus hours you have left and give any of us a ring.
Yeah.
My team will be upset with me if I don't take an opportunity for a plug as well, Alexa. So I'm going to. At Solo, there are no deadlines. We take enrollment. You can come and join our plan on February 1st, on January 31st. So there's no open enrollment deadline. We are month to month. There's no contract other than you have a contract, but you can leave anytime. You're not locked in.
And we would be remiss if we didn't do the same thing. So
There you go, John.
yeah, we have a similar enrollment profile that most of the time, I'd say 90% of the time plus, there's either a qualifying event by joining Opolis or something else that actually will make it easy and seamless for you to transition. We also don't have any subscription fees or anything like that. It's all based, payroll processing. Our services are all based on your consumption. So whatever you decide to do with us. Our primary business is not health insurance technically. So from a monetization standpoint, we don't try to monetize your health insurance. We do this through, a host of services that are, aggregated to one single stop platform that gives you the ease of, lots of things that you need done in one place. And again, anytime you want to, whether it's January 31st, February 1st, February 5th, February 20th, July 16th, it doesn't matter. You can come.
Great. I guess we'll wrap it up there. And as Alexa mentioned earlier, tomorrow, January 15th, is the last day for open enrollment on the federal marketplace. So we encourage everyone who's looking for a plan there to go on our site, freelancersunion.org/insurance, and use the Catch app to see what plans are available to you in your state in the federal marketplace. So thank you all again for joining us. It's been a great discussion, and I'm looking forward to working with you all to ensure that we help build and help get legislators to work on a more equitable health insurance market for everyone. Thank you all.
Thank you, Rafael.